Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a very, very special guest, Michael Grace. He is the CEO of MAG Global Holdings Incorporated. Michael, welcome to the program.
Thank you for having me, Tom.
Awesome. So, Michael, I'm going to reference a very interesting article written by the Pulse Institute. And the topic of the article is a top healthcare executive, Michael Grace, speaks out on healthcare crisis and poverty in the Black community. So obviously that is a very timely topic, and I think a topic that not everyone wants to talk about, but I'm a believer that we have to talk about it if we're ultimately going to solve the problem. So tell us a little bit about your background, your involvement in healthcare, as well as your community.
So thanks again, Tom, for having me on the Virtual Shift. So my background expands 30 years. I can't believe it. It's been 30 years working through the ranks and growing up in healthcare. I graduated undergrad at University of Cincinnati, go Bearcats, and the Ohio State Buckeyes, and graduate at school at University of Chicago. We did not have a sports team, of course. And I started, my healthcare career, learning a lot early on, and then actually having some strong advisors and people that saw something in me that early on I didn't see in myself, and they began to prepare me for what was to come. So real quick, I've been a C-suite executive at some of the nation's premier facilities, University of Chicago, which is now called the University of Chicago Medicines. Before it was University of Chicago Hospitals. I ran operations there, and that's really where I began to grow into more on the clinical side. And then Kaiser Permanente, I was the chief operating officer for their East Bay service area. And then I spent quite a few years there responsible for hospital operations and construction. We built 3 brand new facilities, probably worth, I would say, over about $15 billion. Because, in California, the building codes are different. You have to build new buildings to withstand a 10-point earthquake, which I would never want to be part of. And then I ran Banner University of Arizona Medical Center, which was a 1,300-bed academic teaching hospital with several research facilities. And matter of fact, we were featured on 60 Minutes twice for our Alzheimer's research. And we focused on Medellin and Bogota, Colombia, where we learned that citizens there in their early 30s began to get stages of onset Alzheimer's. And, that facility was very large, a lot going on. I was responsible for all hospital operations, inpatient, outpatient, physician hiring, surgical services, and also we changed the paradigm there where we created distinct institutes around certain diagnosis and illness around different service lines. So women's health, men's health, cardiology, oral and maxillofacial, general surgery, orthopedics, and neuro science, to name a few. And from there, the pandemic right before the pandemic hit, I had my own consulting company. And at that time, things were going well. And then when the pandemic hit, people were like, consulting, we're not allowed anyone in our building. And that's where, we had to transition and do another paradigm shift and got on the digital health side,
Interesting.
where I sit today.
Awesome. And you're also involved in some civil rights activism. I see that you were the Michigan chapter of the Southern Christian Leadership Conference, the only organization in living history that is co-founded by Reverend Martin Luther King Jr.
Yeah, I
Tell
was
us a little bit
honored.
about that.
Yeah, I was honored to be the second president of the Southern Christian Leadership Conference. Dr. Claude Young was the first president. He had been president for 40 years. Dr. Young was the personal physician of Dr. Martin Luther King Jr. He was the cousin of Detroit Mayor Coleman Young. And in 1964, Dr. King said that Dr. Young was the richest African American physician of those times. So I spent plenty nights learning from Dr. Young, hearing about the civil rights, and being able to carry the mission forward was an honor for me. And under his tutelage as well, until he passed away, he was known all over the state of Michigan, city of Detroit. He did a lot for the community. He was one of the first African Americans actually on his own hospital. Dr. Young is a legend. And I always ask, why aren't you writing a book? And he was like, nope, don't want to do it. I'll take these memories, with me. Um, and, one of the things that during the Southern Christian Leadership Conference, three things I'm proud of. One was standing tall and speaking out against grocery store chains that refuse to bring fresh fruits and vegetables and brick and mortar buildings in different neighborhoods of the city of Detroit. We got that done, bringing Myers grocery store into the city of Detroit. Detroit is a huge food desert. You have a store on every other corner, has about 26, 36 different types of malt liquor and beer, but no fresh fruits and vegetables, plenty of honey buns, Mountain Dews, candy, potato chips. So, when we talk about disparities in healthcare and food deserts being one and obesity, that's what happens. The second thing was teaching kids from the age of 6 to 20 financial literacy. We developed a financial literacy program with graduate students from Wayne State University. It was featured predominantly in several news publications. I was interviewed quite a few times for that. And the philosophy was that growing up in inner city, number one, you don't know anything about a checkbook, let alone how to write a check. An ATM card, you don't know what it is, let alone how to use it. And then, have you ever read an Investor Business Daily? Have you ever read the Wall Street Journal? Have you ever looked at the NYSE or the NASDAQ and know what that means? So we wanted to teach children and their parents. If you wear it, if you eat it, if you buy it, you should own stock in it. So if you wear Nikes, the latest and greatest Jordans, you need to pay 50 cents from your allowance and start buying stock in those individual companies.
Wow.
The same with McDonald's, Coca-Cola. And the other was teaching parents that when you purchase something, you have the ability to add your child on there or where their credit will begin to grow, how that looks and how that can set them up for the future. And also, we did a deal at the time with Investor Business Daily that every family or child or individual that was part of that program, they received a free newspaper every day. And the classes taught, individuals how to read those papers, how to do checkbooks. And then we also gave them tablets where they could go online and watch whatever stock they purchased during that time. We connected with a few of the broker companies that didn't charge a fee and allowed them to start buying. You know, today you have Cash App. You can buy. My kids are so proud. They're like, look, Dad, I bought $1.25 of this and that. But they're starting. And the digital transformation in the digital age has allowed us to do that. Finally, the last thing was working with former First Lady Michelle Obama and her health initiatives, one which was obesity. And we came up with a program and had these nice T-shirts, Stomp Out Childhood Obesity. And we featured several different schools in the Detroit, Michigan area where we began to have them fill out pledge cards regarding what they're going to eat, looking at the food pyramid and different things like that.
Interesting. You state in the article the fight against poverty, disparities, and inequalities is a never-ending battle. I understand where you're coming from, but tell us some more about that never-ending battle. That, to me, seems like different leadership is required. Thoughts?
Yeah, I mean, I say in that article quite a few things around that. One thing you said when you opened the show was people don't speak out, people don't speak up, people don't say anything. They just become complacent in whatever they're doing at the time. And that's part of the problem. We know it's there. We walk by it, we see it, but we don't say anything. We get all of these reports from um, different journals and publications, Harvard Business Review, each state, a lot of large inner cities publish now their healthcare disparities report every year. That's nice graphs, nice color. But who's actually taking the lead? And
Yeah.
who is leading the initiative? And where is the ownership? Because to get the buy-in, you have to have ownership. To get the buy-in, you have to be able to lead, show examples of, and discuss and have dialogue around it.
Yeah.
This has been going on through every presidential administration where it always is on the list. Department of Health and Human Services puts out this big report, and all those folks that are working there, what are they doing? So then we bring it, we cross what we call that humanitical bridge and bring it to present day. And we see churches, we see schools, we have community groups, community meetings. And then we have hospitals just about everywhere. And part of what hospital social responsibility is to be involved in those communities in which they serve and all those zip codes that come to them, to be a differentiator and to be able to go out in the community and teach a lot of this and
Yeah.
then say, okay, we're going to do X, Y, Z. Kaiser Permanente, again, one of the best at it because Kaiser's model, most healthcare organizations say that we are a nonprofit and we don't do X, Y, Z. Where Kaiser, first and foremost, is a health insurance giant that brings in gross on the average about 83, $85 billion a year. And their model has always been preventive care. They'll have a 300-bed hospital, but if there are over 100 people in that hospital, they're not doing a good job. When you take a day off work time and you say, I took the day off to go to the doctor. You go there and they say, we saw X, Y, Z. But we want you to go 25 miles to this building, to this clinic, because that's the only one that does this. So now
Exactly.
you got truck cross town, and then they say, we want you, the lab's busy, we want you to come back and get your labs. What if, and I'm using the name of your show, The Virtual Chef. which Kaiser did, was when we sat down, we said, we want everything on one campus. If you take the day off of work, you should be able to see your PCP, your primary care physician. And if they want to do a referral, you should be able to get them on the screen. At that time, we used FaceTime because it wasn't any telemedicine. We had robots in the ICUs that a doctor could use,
Right.
but no telemedicine. So we would get all three parties on the phone and make that appointment for right then. If you needed an MRI, a PET CT for cancer diagnosis, you needed to see an oncologist. You get that done the day you took off. You get your medications, you get your lab work, and then guess what? Before you leave, it all shows up on your phone.
Yeah.
And you leave with all of this. And that is the start. If everyone did something like that, that is the start. And then for those who are non-compliant, haven't seen you in over a year, Tom, we make sure we get you there, even if we have to send a ride to pick you up.
Exactly. Yeah, it's I hear you. My mother-in-law has osteoporosis, and she's had some fractures of her spine, compressions and fractures, and she calls up and she's in pain. Oh, well, the next appointment is 23 days from now, right? So I'm hurting today. I forget about 23 days from now. It's part of the challenge in the overall system. But I want to lead in to the point of leadership. Kaiser Permanente being a model in how you might provide a care in a community, right? It's not just about having everything in one spot. But I went back to listen to Reverend Jesse Jackson in his 1984 speech at the Democratic Convention. He says this about his learnings about leadership. Says leaders must be tough enough to fight, tender enough to cry, human enough to make mistakes, humble enough to admit them, strong enough to absorb the pain, and resilient enough to bounce back and keep moving. The point there being is that transformation of a community, of a large healthcare system, is not a once and done deal. It takes resilience over time in order to change the curves on those reports that you spoke about earlier. Do you think what are your thoughts on leadership, regardless of party, just and in healthcare, about the desire and the passion and the willingness to really change the fight on poverty, disparity, and inequities in healthcare?
So I would say it depends on the healthcare system and what their goals and objectives are internally and externally. A lot of hospital systems have directors, VPs of community relations and engagement. What are the priorities of the board? So it's normally set up by pillars: service, growth, financial, people, and quality. And so when you look at those five different pillars, which one does disparities and social determinants fall under? Actually, it could fall under service, but is that reality?
And can you
And then,
achieve quality with a balance of financials? That's
right,
at the end of the day, right? If quality is the pillar, financials ultimately need to given the disparities and the inequities. It's not about financial reporting on a quarterly basis because you're a public company, and because I think that's part of the problem, frankly. It's really, how do I really change the delivery of care? And you're only going to change the delivery of care in communities when folks get better. And you talk about in this article, racial disparities between blacks and whites have always ran deep. We have a higher rate of diabetes, hypertension, heart disease than any other group. and or what is described as marginalized groups. Our children have a 500% higher death rate from asthma compared to white children. I've been in healthcare a while myself, and I have. You've heard me say outside of this conversation that it's not enough to get somebody in front of the doctor, because the awareness occurs when you're in front of the doctor. You have diabetes. That's the awareness. The doctor can't cure diabetes. Only the change in behavior of the consumer can change your path. But however, when I go home, to your point of what does that neighborhood grocery store have in Detroit, right? No fresh fruit, soda, sugar, candies, all that other stuff. I need access not only to care, I need access to dietary foods. I need access to exercise. I need access, and I might not be able to afford it because I am in one of those communities where the economic shift hasn't yet occurred. Thoughts on that?
Yeah, so I split my time between Phoenix area, suburbia, and Michigan. I've lived in Chicago, San Francisco, Oakland area, in a city called Emeryville, which is right at the foot of the bridge. And I give you an example. It's not just, it's not just the African American communities, because if I go in one of our Hispanic neighborhoods here in Phoenix, it's a lot of sugar. There is a lot of sugar in their stores, of the products that they sell, and a lot of fruit drinks with, corn syrup and other things. There was an attempt to really get the ball started during the 8 years of the Obama administration. President Obama had a summit, healthcare summit, at the White House, invited all these C-suite executives from these large
I
medical
watched that
centers.
on TV. I
Yeah,
remember that summit.
and he focused in on Kaiser and what they've done to really reduce the number of members and lives, because at Kaiser we use the term members and lives, for diabetes and hypertension. Just those two. And they showed the drop when they really began to focus in on disparities in diverse neighborhoods. And it was tremendous. They gave out the plan. Not many went back and did anything. It was like, okay, one thing we use in healthcare is another great meeting, but no action, no accountability. Something has happened with the Biden administration, and I believe President Biden picked up on this and had it tucked in the back of his mind, but didn't bring it out. And it's been quiet. A few days ago, the Joint Commission, which is one of the vehicles CMS uses, now that goes around and accreditates every hospital in the United States,
Right.
has a Joint Commission accreditation. If they don't, I wouldn't recommend you go in there. And if they don't, that means they don't get any funding from the U.S. government. They now have a whole section. I don't know when it's going to go. Right now, they're just doing surveys, but around disparities and social determinants, and asking each healthcare organization what under these codes. So, you know, typically you have leadership, environment, care, administration. There's EC point one, point two. It's probably 3,000 different codes. Now they have a whole section on disparities and social determinants where you're going to be held accountable. You're going
Interesting.
to have something that not only shows that you're doing something, but it can be validated. That has never happened. And this
No.
just happened last week. But to your question on leaders, so the life of a CEO is 3 to 5 years. A CEO in a hospital today is supposed to be a visionary leader, and the chief operating officer runs the overall operation. So being a visionary leader, you're getting foundation funding, you're out in the community. But what happens is that doesn't happen. There's no one out there that's saying, okay, we're just going to take cholesterol. How many of our patients, because can we lower the number of patients that are on atorvastatin or Lipitor? And just use that one. No one has really stepped out that I'm aware of and tried to do that. And if you take it 180 degrees in rural America, where more doctors are aging out, they're retiring, there are no replacement because who wants to move out in the country? Number two, the few hospitals they did have are closing, so you have smaller clinics. And I was visiting my relatives in Fayetteville, North Carolina. They're farmers. They live in the country. And I asked, where's the closest doctor? Where's the closest drugstore? And they said, well, it's 30 miles to town for an emergency for a doctor. Another 40 minutes to town to the closest drugstore. And just think, this goes on and on and on. And they find a way to adapt because we haven't done anything to help them.
Michael, a great conversation, very educational. So with that, I want to thank you for your time, your insights, and I look forward to working with you in the future.
Thank you. Thank you for having me, Tom.
I want to thank the show sponsors, HP. HP Engage Long Lifecycle Products provides the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Genie MD, providing a modular, scalable, and customizable virtual care platform and clinical services to help providers extend care into the home, increasing access and quality while driving new revenue opportunities. If you missed part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern, throughout the week, and be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.